Hi everyone, I'm Dr. Shrestha Mahanti Manjrekar, consultant obstetrician, gynecologist and fertility specialist practicing at Manjrekar Hospital situated at Narvekar Gully, Belgaum. Today I'm here to talk to you about COVID-19 and pregnancy. Since the advent of the second wave of the COVID-19 pandemic, we've definitely been seeing pregnant women and newborn babies being affected by the virus in larger numbers than the previous wave. Today I'm here to discuss what to do if you as a pregnant woman or a family member who is pregnant starts showing symptoms or is tested positive for COVID-19. The research from the first wave of the pandemic did not give us enough reason to believe that as a pregnant individual, the chances of contracting the viral infection is higher. The second wave, however, is telling us that a pregnant individual who gets affected by COVID-19 has a slightly higher risk of requiring hospital admission as well as monitoring. So if a pregnant individual starts developing symptoms such as a cough, a cold, a runny nose, a fever, generalized malaise, calf pain, diarrhea, please first and foremost do not panic. Second step would be to home isolate, which includes wearing a double mask even at home, and please move to a separate room with preferably an attached bathroom so that you do not come in contact with anyone else in the family. Then definitely call your doctor informing your symptoms, and then your doctor will definitely guide you what to do next. During the 15 days period of home isolation, your doctor will periodically ask you for checkups, follow-ups as well as blood tests. But the warning signs that you should report to your doctor immediately include sudden loss of fetal movements when you are more than 5 months along in your pregnancy, sudden severe pain, abdomen, bleeding per vaginum, or in case of symptoms such as breathlessness where your saturation is falling below 94%. These are situations where you need to report to your doctor immediately. General advice for any pregnant patient who develops symptoms of the virus includes charting of the temperature, that is measuring their temperature once in every 6 to 8 hours and maintaining a chart. Second part would be to measure oxygen levels in their body by means of a pulse oximeter, which tells us what is the exact level of oxygen in your body. It's a handheld machine which I'm sure all of you are very aware of. This saturation, if it falls below 94, please inform your doctor. The third part of it would be some symptomatic management for your symptoms. So as prescribed by your doctor, you can definitely take the symptomatic management for your symptoms, which includes fever, a runny nose. Please do not self-medicate. As a pregnant patient with COVID-19, there are certain drugs which cannot be given. We have now come to the topic of testing. So a pregnant individual who has developed symptoms is in contact with her gynecologist. When do we ask for a test? So a COVID-19 test should be planned once the patient develops symptoms within the first 3 to 4 days. Antigen or RT-PCR tests can be planned as per availability as well as proximity. My request would be to not panic to get a test done. If at all your test does come positive, still please try not to panic. If your antigen test comes positive, please don't go running around looking for an RT-PCR test. As per the current guidelines, if antigen test is positive, it does not require a confirmatory RT-PCR test. Preferably in the first 3 months of pregnancy, any doctor or a physician will try to avoid exposing a pregnant woman to HRCT of the chest or CT scan of the chest. Unless absolutely required, this should be avoided. COVID-19 in pregnancy is usually managed by a team approach. It includes a gynecologist and a COVID care physician or a chest medicine specialist. Apart from medications, maintaining a good hydration, maintaining good nutrition, getting adequate rest, adequate sleep, staying engaged with some form of activity when in isolation is very important. Our definite request to all patients who are going through this very difficult time and in pregnancy is to not self-medicate. Please do not take any kind of antibiotics or steroids without a doctor's prescription. The present research has still not conclusively told us whether a pregnant mother has a chance of transmitting the virus to her unborn child vertically, that is via the placenta, or during the childbirth. That said, a pregnant mother who tests positive for the virus in the last few days of her pregnancy needs to be delivered or managed at a facility where there is facility for isolation in obstetric units as well as specialized neonatal care. I hope you find this talk informative. If you have any other questions or queries, we are also available for online consultation. If you just want to follow us for regular health updates on women's health, please feel free to follow us on Manjrekar Hospital Facebook page.